You're about to find out if there really are benefits in using cannabis creams for joint pain. The relationship between cannabis and its topical application in the form of creams has been the subject of study and commercialization in recent years. Could this ancient plant, used medicinally by ancient civilizations, hold the key to pain relief in the 21st century? It's clear that marketing and the global adoption of cannabis have driven the sales of these creams to astronomical levels. According to recent analyses, the market size for legal marijuana reached $26 billion in 2024 and is projected to grow to $102.2 billion by the year 2030. To give an example of the amount of money this market represents, with $100 billion you could buy all the football teams in this list, and you would still have $32 billion left at the end. Do these creams really work? We are on the verge of a new understanding in chronic pain management. In this short documentary, you will discover the answers to these questions. And at the end of the video, we will give you a detailed step-by-step guide on how to apply a good medicinal cannabis cream on your skin. The theory behind the pain improvement process by cannabis creams involves a sophisticated interaction between its active components and our endocannabinoid system in the skin. Step 1: Application and absorption. When a cannabis cream is applied on the skin, cannabinoids such as THC and CBD start to be absorbed through the epidermis, unlike other administration methods. Topical application allows cannabinoids to act locally on the affected area without significantly entering the bloodstream, reducing the chance of psychoactive and systemic effects. Step 2: Interaction with skin receptors. Once absorbed by the skin, these compounds interact with cannabinoid receptors present in dermis cells. The human body contains two main types of cannabinoid receptors, CB1 and CB2. These receptors are a fundamental part of what we call the endocannabinoid system. It turns out our body naturally produces compounds very similar to the cannabinoids in cannabis, just without having to consume the plant. We call these compounds endocannabinoids, and the two most important ones are anandamide, also known as AEA, and 2-arachidonyl glycerol, also known as 2-AG. Anandamide is often called the happiness molecule for its role in generating feelings of well-being and happiness. And 2-arachidonyl glycerol has a role in regulating appetite, immune function, and pain. And as we mentioned a moment ago, the compounds of the cannabis plant act very strongly on both receptors. This is why when this plant is smoked, people often feel that sense of well-being and happiness similar to what anandamide produces, and it increases their appetite and reduces their sensitivity to pain, as happens with 2-AG. The CB2 receptors in particular are found in high concentrations in our skin and joints, and play a crucial role in modulating pain and inflammation. Step 3: Do they really contribute to the reduction of joint pain? The real answer is yes, they do contribute, but only partially. You'll see. For cannabinoids to directly affect the joints, they must penetrate through several layers of tissue, which is a major barrier for most topical formulations. Most cannabis creams and topical ointments are designed to work on the skin and nearby muscle tissue, and there's little evidence they can penetrate deeply enough to significantly reach the joints. Even though direct penetration into the joints might be limited, pain relief and inflammation reduction in the skin and surrounding tissues can contribute to an overall feeling of relief in the affected area. Step 4: Local analgesic effect. In conclusion, although cannabis cream primarily acts at a local level, the anti-inflammatory effects on the skin can indirectly contribute to a reduction in inflammation in the joints close to the skin layer where the cream was applied. It reduces the release of inflammatory mediators and modulates the local immune system. In this way, you can feel less pain in the joint area, leading to better movement in that joint. And if applying creams is not the most optimal way to treat joint pain, what other methods of application are available? In terms of administration, various routes have been explored, including inhalation or vaporization, oral capsules, oral oils, and mouth sprays. It's important to stress that these methods should always be prescribed by a medical professional specializing in pain. Consider other medications you're taking and their potential adverse effects with the joint administration of cannabis. Moreover, cannabis itself also has side effects like any other medicine. It doesn't matter that it's natural, including dizziness, drowsiness, dry mouth, nausea, and diarrhea, although these are generally considered less severe than adverse events associated with standard painkillers like opioids. How to choose the right cream. It's very important to check that the cream you use is medically approved and legally allowed in your country. This prevents scams and creams that really don't have the active compounds they claim to have, which puts your health at high risk, and even more so if you have an underlying disease in your joints. Try to look for creams that contain CBD as the main ingredient, since it has analgesic and anti-inflammatory properties. And also, avoid products with THC to not risk generating psychoactive effects after their application. Besides pain relief, some creams provide moisturizing and skin regeneration. Make sure the cream you choose includes moisturizers like hyaluronic acid or other moisturizing gels recommended by your trusted pharmacist. And for proper application, you must follow the instructions below. Preparation. Ensure the area to be treated is clean and dry before applying the cream. Amount. You don't need to use a lot. A thin layer is usually enough. Spread the cream evenly over the affected area. Massage it in by gently rubbing with your fingertips until fully absorbed. This not only helps in the absorption of the cream, but also in relieving the sore muscle or joint. Frequency. The general recommendation is to apply the cream twice a day, once in the morning and once at night. However, it is always best to follow the specific instructions of the product or the recommendations of a health professional. Precautions. Avoid applying the cream to areas with mucous membranes and discontinue its use if you experience irritation or an allergic reaction. Consult a doctor before using if you are pregnant, breastfeeding, or taking medications. What is my final stance on using cannabis creams for joint pain then? Based on the available evidence, cannabis creams might be considered an additional option for joint pain management, especially for those seeking alternatives to traditional painkillers. However, it's crucial to select high-quality products and discuss their use with a healthcare professional to ensure safety and suitability for each individual's specific case. However, there are countless studies on the potential therapeutic uses of cannabis. Current evidence suggests that there are moderate benefits in using medical cannabinoids for chronic pain management, including improvements in sleep, anxiety, and quality of life for patients with conditions like HIV, multiple sclerosis, fibromyalgia, and arthritis. This short documentary is part of a series of 20 short documentaries about cannabis and its effects on our body, in remembrance of the always classic April 20th. I recommend you watch them all if this is a topic that interests you. The comment that gets to 1,000 likes defines the next video of the channel. Remember to like and share if you learned something new. If you want to learn how to create content like what you just saw in this video and make a living from YouTube, I leave you a free class in the description section and first comment of this video. Remember also that your support is very important for us to grow as a channel. You can buy your Tuvi membership for very little money and access all the benefits we offer our members. I really thank you. Next, you'll see 2 videos that are of interest to you. Sending you a hug. See you next time.